Foundation University College of Dumaguete City. So in this video, I will be performing the cord dressing. So without further ado, let's get started. Cord dressing is the cleaning of the cord stump in an aseptic manner in order to maintain sterility and prevent infection. So for the purposes, it is to assess the status of the umbilicus and to facilitate the healing process of the stump by removing contaminants adhering to the dried secretion in the area and to prevent infection and maintain sterility. For the assessment, we must assess the condition of the stump, and then we must also inspect of signs of infection as well as checking the presence of blood vessels. And then for the last one is we must also assess the diameter of the cord. Cord dressing nursing diagnosis is risk for infection, risk for injury, hyperthermia, and knowledge deficit. For the planning, we must determine what supplies and equipment are needed, and then we must also wash our hands for infection control. And then for the last one is we must obtain the needed equipment. Disclaimer, some of the equipment that has been used in this procedure are improvised. So let's assume that I am using some of the proper equipment. The equipment needed for the cord dressing procedure are wet cotton balls. Instead of betadine balls, we can use the alcohol balls, gas sponges, cotton applicators, picking forceps, working forceps, sterile water, clean cord binder from the mother, and then the sterile gloves. The first step is obtain all equipment, cord dressing tray from the CSR to start the procedure. Next, wash the hands in order to prevent the transfer of microorganisms. After doing the hand washing, next is explain the procedure to the mother. This is done to relieve the mothers from anxiety and gain cooperation as well. So let's assume that I am talking now to the mother's baby. Hi ma'am, good morning. I am Jessica Kabasag. I am a student nurse. So today ma'am, I will be cleaning the cord stump of your baby. And then the purpose of this cord dressing, ma'am, is to prevent infection and maintain the sterility of the cord stump of your baby. Is that okay with you? Okay, thank you, ma'am. Place the baby in a safe area within the unit of the mother. This is to prevent the baby from falling or any injury. Now, put on a pair of sterile gloves. Carefully and slowly remove the baby's binder and expose the cord area only. Now, remove the used sponge covering of the cord if covering adheres to the stump. Then saturate sponge using the wet cotton balls. Get another wet cotton balls and do the same thing again. After that, assess the appearance of the cord stump and smell for any change in odor. This is to check for presence of discharges and check for signs of infection of the stump. Now, clean or paint the surrounding area of the stump in a circular motion using the alcohol balls. I am using now the cotton applicator to clean or paint the outer portion of the stump, especially the inner outer of it. Get another cotton applicator and do the same thing again. Now, dress cord with a new gauze sponge to maintain sterility. Keep the sponge in a place with the use of a corn binder. It is used to prevent injury and infection to the stump. Do aftercare of the equipments. After that, remove gloves. Then, wash your hands again. Return tray to the CSR and record the date, time, and described condition of the cord stump. This is for the documentary purposes.